Hi, welcome to Monetizing Innovation. I'm John Holcomb, the best-selling author of Creating Value Faster. Today on Monetizing Innovation, we're joined by Laura Marie Peltonen, President-elect of the International Academy of Health Sciences Informatics. Laura operates at the intersection of health, data, and global innovation, helping shape how informatics transforms healthcare systems and outcomes. With deep experience across digital health and strategy, she brings a unique perspective on how data driven insights move from concept to real world impact. In this episode, we explore the future of health informatics, the challenges of scaling innovation across complex systems, and what it takes to translate data into better decisions, outcome, and value. Thank you so much, Laura, for joining us today. Really looking forward to our conversation.
Thank you so much. It's wonderful to be here.
And Laura, it's really amazing to just look at your career, and most recently as president elect of the International Academy of Health Science Informatics. What do you see as the biggest gap between the promise of health data and the reality of how it's used today?
That's an excellent question. I think we're not even halfway through there. So I think the promise of health data is enormous. But the gap that I see is most between like insight and action. First and foremost, I think we are investing in data collection, but we don't really know how to benefit from the data collected. And I don't think we're really clear about if all the data we are collecting is necessary or adds value to what we do. And also the evidence to practice lag in healthcare still is on average from in somewhere between 15 to 20 years. And that's something that hasn't changed during my career at least. So I think that's one of the major issues that we still need to figure out how to tackle. Yeah, so last year I was, for example, I went back to the clinical floor to observe ambient AI tools in NHS hospitals. And this was like eye opening, being in academia for more than 10 years now alone. Before that, I used to juggle between the two different roles in academia and practice. But like going back to the clinical setting, it was quite eye opening how things have progressed and everything's becoming more busy. We have run out of resources and clinicians are really, really stressed with the workloads they have. And I was observing these ambient AI tools in these NHS hospitals. And during this one observation, like the computer restarted a few times that morning and the workflow didn't really function well in terms of the ambient voice technology tool because like the system obviously was built for like one patient at a time situations where these clinicians were juggling like several patients in one go, and that didn't work out very well always. There were so many situations and experiences just bringing back the research, the technological development, like innovation back to the clinical setting, and I think that's very important. We really need to go back there and see how it actually looks like to get the best solutions developed and implemented. So I think these kind of things are the things we tend to miss. We are quite eager to get in there with our new solutions, but we have a lot of data, so we're like data rich, but we are somewhat insight poor. Don't necessarily prioritize in terms of the appropriateness of what's actually needed. But we come up with fancy tools that we just want to put here and squeeze there, and we're not really sure if it's going to work at all. And I think, yeah, so I think we fail in the implementation thing. So based on my experience, I think we do develop technically wonderful tools, powerful tools. We have so many with the new AI development, for example, the language models and their all the application possibilities that we have. We still fail to see how those should be placed into the clinical workflow.
Yeah, I think that's such an incredible point that you make too, right? Is being in such a data rich environment plus having some of these new tools, it still comes down to, how do we look at the data? How do we humanize it? And how does it work with the actual users? And you highlighted that's one of the big challenges.
Indeed, indeed, and I think like we often lack the infrastructure around that, and there's a lot of like needs based development that we still need to do. The systems that currently are in place are not necessarily supporting the decision makers on different levels, different specialty areas, and so forth. But I think it's also about like the skills and abilities to use those, even the awareness of those systems. So we have a lot of, for example, AI technologies implemented into the everyday tools in hospitals, but are we literate enough to use them in the way they're intended? Or do we just work around, how they were supposed to be used and figure out a way how they support what we are doing?
Yeah, that's such a great observation because it really is true. I think the combination of especially healthcare workers really trying to, I guess, increase the number of patients seen, right? Especially from the economics, right, of the healthcare systems. And then the challenge, though, of like a data rich environment, it's very difficult for the actual practitioners to really utilize it the best. So to your point, they have to learn along the way.
Indeed, indeed. And also just figuring out the infrastructure on a larger scale. So having a strategy for the technologies and tools that would support the decision makers within the organization on different levels and in different specialties, but making that strategic and systematic and not random, because there's going to be so much waste in many ways if we just randomly go and pick here and put there and all of that. So it's sort of like having a strategy and making it fit the needs of the organization, and then building on with the competencies to actually spread the knowledge and skills on how to use those. I think that's why, and that's how we would get to better results.
Absolutely. When you think about it, especially from your global perspective, what differentiates the healthcare systems that have successfully leveraged the data from those that fall behind?
Oh, that's a good one. That's a good question. So I think, yeah, indeed. The systems what I've seen. So even here in Finland, we are quite far in healthcare
Mhm.
digitalization. So we've had EHRs for like since the early 90s. It's been there. We have so much data. We have national health data registries and all of that, and observing both here within Europe and internationally. I think what would discern the leaders, the good, yeah, those systems that are like really successful, they would have the right attitude. So their leaders would pull ahead with data as an infrastructure instead
Mhm.
of like thinking of data as like a byproduct or a project. They would think that this is a big central focus, a key
Mhm.
process in the whole organization. They would invest in the infrastructure, they would invest in governance, they would also invest in trust and workforce literacy. So really supporting each and every member of that organization to buy into these technologies. But as I said earlier, it's important they are like strategically planned and implemented. If we fail with one technology and we implement it too early, or if we give expectations that aren't met, we'll lose the trust of the clinicians. And then it's very difficult to try to regain that trust. We should invest in this, like, these sort of infrastructural and competency and trust related issues as much as we would invest in the technology. I think so. We did in one project a Nordic Baltic federated data network. So we were building this one, and the hardest problems were not the technological infrastructure, but it was more about like the governance, the collaboration between this interdisciplinary group, building this thing, because you can't do it without the lawyers, the ethicists, the algorithm developers, computer scientists, the clinicians. You need to have all of them, and learning the language, understanding the legal basis, and all of that is far beyond how you train an algorithm. The levels of complexity. I mean, so I think, and in particular, like here in Europe, we have a quite comprehensive and clear legal ecosystem in
Mhm.
terms of how we use health data. Yeah, and of course, in the healthcare context, we've got the
Mhm.
medical device regulation. We have the GDPR, so the General Data Protection Regulation, which is like the framework for how we use personal information in Europe. We also have like the European Health Space coming up, which is a framework for sharing health data across countries within Europe. So you would be able to access a patient's health data if they go on a holiday to another country, for example. So it would improve primary like data use, but also like secondary use of data. So we would be able to build these sort of like multi-country distributed learning networks in a better way, but we still lack some like legal framework to support that work. And it's like an ongoing process. But I think like altogether, Europe has quite a good legal framework. Also the new AI Act, which is risk like a level based. It's sort of all of those would support how we use the data, how we are able to really exploit the opportunities to improve health and care. And here also, when we are talking about like multiple languages, so if you look at the big models, they usually tend to work quite nicely on English. But then when you go to a small country in a small language, they would perform quite differently. So all of those solutions would look a bit different in different places. And I think going back to your question, what would differentiate the successful systems? I would say it would start with the attitude, but also the interest in engaging with these all different kinds of opportunities we have, building the infrastructure, building the competencies, and just being brave enough to move forward.
I think that's such a fantastic point too, because I think especially when you talk about the different countries, and like you said, there have been some steps forward, right, with the AI Act, but it's such a challenge, right, to be able to bring all these stakeholders together and have the leadership aligned with then the actual those that use the system, because we're all humans and we all have our behaviors to influence, right? Um, and that attitude is so important. I think you highlighted, you know, when you see some of that, what are some of the things that you really see where AI has the greatest impact in the next 10 years?
So that's a brilliant question. Yeah, I think we need to invest in how to prioritize that because we're quite limited with resources, and health systems are struggling with like social sustainability in terms of workforce and also funding and all of that. So I think AI has a huge potential to support automatizing bits and pieces of workflow, which are low risk, for example, or which
Mhm.
are not very complicated, but also in terms of like documentation or data management, analysis, all of those kinds of things, reducing like the administrative burden or documentation burden, as I said. We got these ambient voice technologies, those, but also like multimodal. So we do have the opportunity to capture data in multiple forms and formats. So why not investing in those? And I think one other thing which is quite interesting is like what kind of like how broadly do we collect the data? Because we tend to develop algorithms and prediction systems based on structured medical data, physician notes or lab values. But there's so much more data that we're collecting, nursing data, for example, nursing assessments, and those.
Mhm.
So the nurses do stay with the patients in the hospital, for example, around the clock, and in that sense, they do observe and document a lot of trends and trends data and other important signals that would really bring more value and accuracy to the predictions that we could really exploit that kind of data, which is currently sitting quite idle. Yeah, I think those sort of things are like low hanging fruits.
Yeah, I
But
think
we
I'm sorry. I was
please.
just gonna. I think you bring up such a great point, right? Especially with, say, some of the healthcare data that is collected with, like, say, nurses at the hospital. Um, there's almost too much data, right? In the sense of to
Mm.
be able to do that. Where I do like your point. I think AI could really help, right? Do more of that trend detection. That by looking at the bigger picture of the data set than what is possible, right, in a hectic hospital environment.
Indeed, and also thinking like beyond like physicians and nurses. So we got physiotherapists and other kinds of like allied health professionals, and all of them do have their unique angle to patient care. And if we go beyond home care or these sort of environments, that we have a lot of data that can be used to support the monitoring, the care planning, the evaluation. And I don't think we're really systematically collecting that. So in terms of like also Internet of Things, wearable devices, and all of those. So we do struggle in the future with the workforce, as I mentioned earlier, and we need to invest in the services that we provide for elderly in particular, at least in the European countries. The aging population is going to be a big challenge, and I know that's global, so as well, of course. But like, how do we prioritize the most urgent needs to make sustainable healthcare for the next decades to come? So I think that's where we should start the discussion. But as said, AI is an amazing opportunity, but also a huge risk. So I could mention, like, we just yesterday we published in the Lancet an article, and we were auditing 2.5 million biomedical papers, and we built this AI pipeline to help us do that. And we saw that fabricated citations have risen 12-fold in 2 years. So the inflection point was in mid 2024 when generative AI writing tools went mainstream. So that's an alarming thing, and these results, as I said yesterday, published. It's a new thing, but identifying the risks and challenges that the AI tools also bring along, we need to be observant all the time and think think smart, to not go into those like over reliance problems where we just think everybody is as it should. So based on the article or the study that we published yesterday, there was like one paper in 277 papers last year that cited a study that doesn't exist. So it's real. And we do know from prior work, prior research, that these paper mills have produced papers that have ended up in clinical guidelines. So it's a
Mm.
real threat to patient safety if we base clinical decision making on guidelines that are based on reviews, which are based on references that do not exist. And that's actually quite scary. So the work that we were looking at and the recommendations that we have is like, we need to be mindful of this situation, but we need to build safeguards, and we should have like automated reference verification systems like already before the papers go out to peer review for the first time. And we need some indexing services that would attach like reliable metadata to the journals that these have been checked and the references are reliable and those sort of things. And I think we also highlighted a need for publishers to really retrospectively go back to their publications, the existing publications, and do corrections or retractions of papers which have so many badly fabricated references that compromise the results or the conclusions of those articles. And then, of course, these research integrity databases, those would need a distinct category for this kind of a phenomenon for faked fabricated references, that we would be able to systematically monitor them. As I said, the number increased 12-fold in a few years. So for sure, it's just going up as we speak. And I think this is one of the examples that we need to be aware of, and we need to increase the understanding and the risks that these powerful tools bring along.
Yeah,
At least,
absolutely. That's an incredible example too, because my mind went to a different place and risk. And then you brought up one of the things that is, like you said, it's literally happening today, where if we can't rely on some of the data sets because it's generating these references that don't exist,
indeed,
it
that I
creates a
think
real
it's
danger. Yeah.
It does, and this is why we urgently need to build safeguards and structures around it, so we can tackle this problem before it explodes. And it's not all about like publishers, but they have an important role there, but also authors. Like each and every researcher should really verify the references that they do use in their work, and not only like how you put it in your reference list, but also ensure that how you cite it actually justifies the claim that you have. So like it's all about like high quality ethical research, really.
Absolutely, and it just goes to show. I mean, some of these tools that have now become commonplace, right? That we're trying to leverage to be more productive, can also work against us, right? Especially when we're trying to do publications and things like that. And it's it is a fascinating challenge when you think about it, because some of that capability is here now, right? And
Mm.
folks are using it. But it points out, to your point, the need for that. The human interaction is still critical, right? It's still that human centric aspect of verifying, ensuring that it's real, that we're not getting this hallucination in the data set.
Indeed, indeed. Yeah, so I think AI is probably the biggest hype right now, and I'm not sure like in terms of like how we are quite excited about that, but at the end of the day, how glamorous will it be? It's limited what we can do with that, and we will always need the clinical judgment there. Yeah.
No, and I think you brought up such a great risk situation there, that the risk can multiply, especially you start citing one study over and over, right? And it's just,
Yeah.
yeah, it's amazing when you think about some of that.
Yeah, we're actually doing so there with Professor Max Topaz from Columbia University is leading this work, and we're actually doing like follow-up work to see where they end, like how the process continues. So now when we have identified those references, those fake references, then the next step, like what happens then and where do they go? So that's a ongoing work to be reported later on. But I think the system we built was sort of focusing on finding the articles quite clearly, and we had quite sort of thresholds which weren't too strict. So what we did find through this complicated several stage process was like the tip of the iceberg. So if we were more brave and dig deeper, we would find much more than what we did. So we found about 4,000 fake references in was it 2,800 something papers, so almost 3,000 papers. And that in itself is quite alarming. But again, we're at the beginning of researchers starting to use these writing tools, and the risk of hallucinations and that it's gonna amplify as these tools become more mainstream in the research as well.
You
Uh,
know, I think you point out too, you have such a respected system too, with like peer reviewed articles, right? I mean, uh, so it's sort of an existing system, and it goes to show too how we have to be very mindful of the AI or any tool that we would use, as we are, because it had its own safeguards in the past, right? But now, as the technology is outpacing some of that, it's a great case study, I think, that you point out, that we have to be very mindful of these
Yeah,
risks.
indeed, indeed. So the peer review system is broken with the paper mills, really like predatory things going on. All of those do challenge, but also the tools that help us report faster. So AI does what it does for us is it helps us do what we used to do faster. It's not going to fix any broken pipelines, but it's going to help us do faster. So we'll produce more, but the number of reviewers is the same. So what we all of us academics experience is like we get so many review invitations, we can't even respond to all of those, and the timeline for reviewing for if you would submit your own paper, it's just extending and it's extending, and it's becoming like unsustainable. And that we're surely going to need some tools to automate those parts of the review process workflow that can be automated. Again, always
Mhm.
mindful of keeping the human as the decision maker in the process, but some of those bits and pieces could be supported with AI just to make the system sustainable. So it's sort of a balance between like the tools that we have and the needs that we have and the resources that we have. So it's like finding that optimal balance and learning to use the tools in the right way. And maybe going back to AI tools overall in healthcare. So we said something earlier about how do we develop those? How do we identify the needs for what kind of tools do we need? Like, what are the most critical issues that should be solved with technology in healthcare? And going back to clinic to see the real world and really reflect on that. But I think like one of the biggest challenges that we have is when we do start the development of some process of some technology, tend to involve the stakeholders, end users and patients far too late. So we should have them, all of them, and not only, so based on the research we've done, we really see engaging stakeholders from system architects to linguists or all of those different disciplines to actually make well functioning, effective and impactful tools. So this kind of a co-design interdisciplinary thinking is a key foundational requirement for any kind of health technology development and innovation within healthcare. And the other thing I think is as important is the collaboration, not only between disciplines, but between fields. Within the European Federation for Medical Informatics, I'm currently the institutional members representative. And within the institutional members, we have representation for healthcare organizations, academic institutions, research institutions, and industry partners. And we have these discussions, ongoing discussions continuously around, well, timely issues. And I think how we do get into the biggest and most
Mhm.
functioning outputs is not working in the silos we are used to do, but is the collaboration between the different, of course, disciplines, fields, but also like actors in this space. So we do need more sort of joint development. And I know from the industrial perspective, academia is way too slow, but there are things we can do to improve. So in some projects on the academic side, we are developing frameworks for evaluation, for ethics, for these sort of things. And we are bringing the evidence on how to develop those tools and feed those directly into the development process for industry. But these kind of things actually need quite a lot of infrastructure around. And I think, for example, in Europe, we have a few of those different funding mechanisms that support this kind of work and which makes the projects like interdisciplinary, international, like multi-country things. And then we are able to share also the experiences, the needs, and make the systems that we develop even more like transferable from setting to another and all of that. So I think those probably would be the foundational elements of success.
Yeah, I think you bring up such a great point with that as well. And it shows that there is that true need, right, with academia, industry, and government all to come together to really, at a high level to set the right policies. But then, like you said, it's also that cross functional work on, like on the ground as you're developing the systems. And it goes throughout the entire ecosystem that you're talking about.
Yeah, yeah. I think like failing on one of those or working in silos, it's not going to bring anything that adds much value to the
Exactly.
sustainability of the system, actually. So it might be a nice thing that you can add on top of something, but that's not how we solve big problems. We need collaboration, we need shared language, we need a shared understanding of the actual problem and how to solve it, and a lot of negotiations and discussions. But I think those projects with like complicated projects with like multiple disciplines, professionals, like industry, academia, healthcare partners, for them, it takes longer to get started. But at the end of the project, they're outputs are just amazing compared to the other ones.
Exactly. Yeah, I often like to call it the power of we, right? Because it really
Yeah,
does take a group of us to really drive the appropriate change and take into account, like, how do we balance the risk with the benefit?
absolutely. I really like the power of we there. Can I cite that?
Absolutely. I use it in my book quite a bit too because it's, to me, that's one of the things I found over and over again, especially working in some of the healthcare areas. It takes, really a village, right, to get new technology through the healthcare system, but rightfully so, right? Because you're trying to balance the risk at every stage. And so, um,
Indeed.
yeah.
And when you have, when with health data in particular, it's a lot about the legal framework around
Mhm.
that also. So it's quite difficult. Nobody really seems to be an expert on everything, and everybody is an expert on something. But like having the experts understand each other, that in
Exactly.
itself is like, wow, it takes for forever. Yeah, it takes years to build that, like the shared language, the shared understanding, the shared pace, uh, but also the trust. I think.
Absolutely.
That's something that doesn't come first. Something that needs to be worked on for some time. And I think,
Absolutely.
please.
Oh, please, I'm
Yeah.
sorry. Go ahead.
I was just thinking, like, one other thing we haven't discussed yet is like the climate sensitiveness of all of this, and healthcare being one of the biggest polluters of all industries or all fields. I think when we transform healthcare with the technologies and try to make sustainable systems in terms of economically sustainable and like socially sustainable, but
Mhm.
also environmentally sustainable. So I think in the future, this is often overlooked, but we really would need to invest more in the environmentally sustainable solutions. And if we have a choice, then please let's just choose the better option there. But it's very difficult. We've done some research around how do you evaluate the environmental impact of a technology. It's super complicated, and there's like so few tools out there to help you do that. And of course, when you're doing a decision as a healthcare leader, the first thing you're thinking about is the cost. The second is like maybe impact effectiveness or something like that. Like environment, it's not on the top of that list. And I think,
Yeah.
unfortunately, of course not. But I think if we had tools that would be easy to use, somewhat, somewhat informing of the options, I think this climate impact could be one of those sort of items that could be placed into the equation when we do those procurement decisions.
Yeah, I think that is such a huge point that you make because it does. It comes up like, just think about pharma for instance, right? Their focus is on, the molecule that's going to help the patient with their indication. But then you have to have the delivery device, right?
Mm.
Climate's not necessarily a thought in that equation, right? It's usually, okay, well, how do we get that molecule safely to the patient and make sure the patient adheres to the treatment? But then also, I think you bring up another great point about climate, especially with the rise of AI, and some of the energy requirements, some of the cooling requirements as well, it further strains sort of the climate system, right? And it's
Mhm.
something that if we think ahead, we can impact, but if we let it happen, it's very difficult to undo.
Yes, this again. So
Mhm.
I think your point there about like awareness and being on top of the development curve here. So things are happening so fast, and it's even for the experts, it's so difficult to you stay up to pace. And like how do we do that? We need to be so systematic about it and really invest in this so that people actually have time to sit down and think in this time when we're so busy to just put out fires. We can't even think and plan of like what's going to happen next week. And I think this needs to change. We need to be able to see further, to be able to predict those risks and prevent them from happening. Otherwise, for sure, we'll end up in a bad place.
Yeah, I completely agree with you, right? And we have developed into this sort of reactionary society, I think globally, right? And we really do need to really, at least in certain situations, right, make sure that we're reinserting some of that thinking time to be proactive. I couldn't agree with you more. I think that's a fantastic point.
Yes, yes, indeed, indeed. So we have so many opportunities, but also, of course, we need to invest in understanding the risks and trying to stay well, not necessarily ahead of time because that might be impossible, but at least like keep up to the challenges
Yeah,
that we're gonna
exactly.
face.
No, and I think it goes back to your earlier point about the interaction, right, with academia and industry and government that, uh, you know, there really is sort of that push-pull tension that is needed to balance out, right, some of these critical issues ahead.
Indeed, indeed. I think also like health system resilience overall is an emerging theme, I think, across.
Mhm.
We're talking about, like we talked about the social, the economical, and all of those. But in terms of the climate change, we are looking at really changing conditions and we are looking at heat waves, we are looking at floods, we are looking at fires, those sort of like natural catastrophes will for sure stress the health systems more than before. We had the pandemic as an example, but now we also have warfare and
Right.
the geopolitical situation and all of that. We are living in quite unsecure times, also on so many levels, and how to make the systems able to provide all of the care to meet the needs of the populations. I think we will need to work hard for this. Yeah.
Absolutely. I think it also, you hit on the importance of the leadership that's needed, within the healthcare systems to really make sure that we're addressing some of these issues and, having that correct mindset, right, to really drive home, how do we balance the benefit risk? I think it's phenomenal the work you're driving. And yeah, such a great conversation today, Laura. I really appreciate it.
Yes, thank you very much. Thank you. It's always it's very empowering to talk about this, and it also helps reflect and think further. Like, what are the next steps? What should we do? What can we do more to not only improve the situation locally, but also globally? The V effect, as you were talking. What can we do to help also those settings which are less privileged? What can we share? How can we support? How do we prioritize these kind of collaborations and networking and learn from each other? I think those are all important points that we need to take with us
A-
as we move forward.
Absolutely. Well, one last question for you, Laura. Is there anything that I should have asked but haven't asked yet, and that you'd like to make sure we share with the audience?
Oh, that's the one. This one. I think you covered it quite well. Quite well, all of those inputs. We can continue next time with the next questions. Yeah,
well,
yeah. What a lovely podcast you have here.
well,
Thank
thank
you.
you. Yeah, no, thank you so much. And I definitely would love to have you back again because I think like you said, we just covered some of the tip of the iceberg, and we could actually go deeper in each one of the segments that we talked about. So I so value the work that you're doing and really appreciate you sharing your insights with the audience.
Yes, thank you so much. Yes, I hope this is useful to someone.
Oh,
Thank you
no,
very much.
absolutely. This is fantastic. Thank you so much.
Thank you.